On today's World Insight, South Korea has the second largest coronavirus outbreak in the world. Can Korea contain the virus in the city of Daegu? And I speak to Dr. Gauden Galea, WHO representative to China, as we examine the numbers behind the coronavirus epidemic.
It is impossible to fake all these sources of data and make them all say the same thing.
And here's our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei in Beijing. We begin our program with the COVID-19 spread. On Thursday, renowned Chinese specialist Zhong Nanshan said he is confident that the novel coronavirus outbreak will be under control by the end of April. But while the news in China could be sounding at least promising, the situation in South Korea is getting really serious as we speak. It has the highest number of cases outside China, over 1,500. South Korean President Moon Jae-in described the situation as very grave. Authorities are racing to test some 200,000 members of a church in the southern city of Daegu, where South Korea's outbreak is believed to have begun. Meanwhile, organizers of the table tennis world champions in Busan say they will postpone the tournament until June over virus fears. For the latest on South Korea's outbreak and its economic impact, let's take a look at all of this brief information first before I go with two South Korean panelists to discuss the real situation.
Pukchon Hanok Village is a popular South Korean tourist destination. Houses built using traditional Korean architecture are the main attraction. But these days, nearby local businesses are having a difficult time staying open. That's because the coronavirus spread is keeping tourists away.
We had planned to spend a few days in Seoul and go to the DMZ and go to some museums, and so far everything we've tried to do has been closed.
There's a lot of uncertainty at the moment surrounding the spread of the COVID-19 coronavirus here in South Korea. That's why it's difficult for experts to predict the exact impact the outbreak will have on the country's economy. But if these empty streets at this otherwise popular tourist spot are any indication, the negative effects could be far-reaching. Consumer sentiment for February in South Korea fell by its sharpest amount in nearly 5 years. Business sentiment also slumping, even before the recent outbreak. And manufacturers have long been suffering from slowing exports and disruptions to global supply chains. That's why the government is stepping in. President Moon Jae-in calling for the allocation of emergency funds to combat the coronavirus spread.
In addition to deploying the emergency fund set aside, the government should review the drafting of the supplementary budget after coordinating it with the parliament.
But some experts have doubts over whether emergency funds are necessary to boost an economy already suffering from low growth.
At least economics-wise, we can, I think, use the existing budget, but I think politically, the politicians as well as the government want to be seen as doing something, and they might think that getting additional budget will be easier than rearranging the current budget so that COVID-19 is covered.
Early forecasts suggest the tourism industry could lose anywhere between $2 and $4 billion in revenues and 78,000 jobs as a result of the COVID-19 outbreak. And that's a trend South Korea's economy can't afford to go viral.
And for more on the coronavirus outbreak in South Korea, we are joined now in Seoul by Dr. Alice Hyun-Kyung-Tan, who is an internist at Ms. Medi Women's Hospital in Seoul. She was involved earlier in the MERS outbreak in that mission. Dr. Tan, welcome to our program.
Thank you for having me.
What is your assessment of the latest situation? Of course, we see the official numbers, but do you think the situations are much worse than the current number? As we know, there is a long incubation period, and people could be asymptomatic for quite some time.
I think we're at the rapid escalation phase right now of the epidemic. So as we are ramping up the testing of suspected cases, I am sure in the next days and weeks to come, we will have many more positive cases. I'm concerned about the fatalities that we've been seeing. As of this morning, our case fatality ratio is 0.75%, which is less than the value posted by the WHO, which was 2.3%. But I'm very concerned because many of these fatalities have been occurring in patients who were at one hospital, the Cheongdo Daenam Hospital. And I'm worried that we may have missed our window of opportunity to successfully treat and cure these patients. They were considered high-risk cases. My second big concern is whether or not the healthcare system will be able to withstand the strain that it's seen with the recent surge in cases and the surge that's most likely going to go on for the next few days. This has led to a relative lack of isolation beds, a lack of medical personnel, and a lack of medical supplies relative to the huge need.
Okay. Dr. Tan, if you can, let's just step back a little bit. I know it's an emergency, so everybody is talking about right now, but just step a little bit. Look at the track record over the past few days since the first few cases popped up. What have been this pattern that South Korea has found out? And how likely, with what speed, do you anticipate, with your previous knowledge, that things might develop? I'm saying might develop because nobody could really predict it for sure.
Well, what we're seeing is up until case number 31, the pace in terms of how many new cases we were seeing on a daily basis was relatively slow. Since case 31, there was an explosion of new cases, and the majority of them were concentrated in two clusters. The first being the Shincheonji Church in Daegu, and the second, the Cheongdo Daenam Hospital, which I just mentioned. Epidemiological investigations have led to the theory that at the Shincheonji Church, there were two waves of infections. The first probably started around February 7th, and at the Cheongdo Daenam Hospital, the first cases of fever reported in the patients was about February 15th. Now, we know that COVID-19 is a highly transmissible disease, and the problem, of course, is that in many cases, in the early stages, patients don't know that they're sick. The symptoms can be very, very mild. And so the problem is these patients with very mild symptoms, they can remain active in society.
That's right.
And so that is why we are taking massive measures to break the chain of transmission. And huge requests have been made, and also legal measures are being taken to enforce self-isolation of high-risk patients. We're hoping that we can at least contain the spread among close contacts.
Yeah. You know, Dr. Tan, you are now based in Seoul. You know people in Seoul and many other megacities in terms of the South Korean case, are very concerned about the spreading to the huge cities. Now, what are being done that you as a professional consider extremely important already or yet to be done at this moment?
At this moment, so as I mentioned, we are taking dramatic measures to try to break the chain of transmission. And what this means is Daegu and Cheongdo County have been designated special infection management zones. And so the citizens of those areas are asked to remain inside as much as they can. The 9,300 members of the Shincheonji Church in Daegu are under legal orders to remain in self-isolation and to undergo PCR testing for COVID-19. They are required now by law to comply. The plan is also to test every person in the city of Daegu, that's about 2 million people in that city, who have acute respiratory illness symptoms, so that we can quickly detect our positive cases and isolate them. Throughout Korea, many events and places where people gather are either closed or they've been canceled. So the schools are closed, churches are closed, study academies. This is graduation season, and many of the graduation ceremonies have been absolutely canceled. Concerts, symposia, they've all been canceled. And so these are very dramatic steps. And because there are patients who are asymptomatic and they can still spread, and also I talked about the mild symptoms, that's why we need to take these measures so that it does not continue to spread in the community.
And another question before we go to another aspect of our discussion, Dr. Tan, is what do you think could be the joint efforts coming from different players inside your society, whether it's government or civil society or private sector, that are being done so far in order to make sure prevent control could happen in a more efficient way?
So we have, as you said, many branches of society are working together here. We have the government, which is leading, of course, the effort. And then we have the cooperation of the medical hospitals. Our medical system is different. Our hospitals, most of them are private, actually. We all have Korean National Health Insurance, but the institutions themselves are private. But of course, they are now under the authority of our central sort of control tower that is coordinating all of the efforts. Many private companies have stepped forward and donated supplies, and they've donated financial support. We've had individuals as well donate financially, and doctors around the country have stepped up. They're giving up their vacation time, and heroically they have volunteered to help their colleagues in Daegu, in Gyeongsang-Bukdo province, because they know that medical personnel there are lacking. And so we are very, very grateful, of course, to the young men and women physicians who are volunteering at great personal sacrifice to go and help in this effort.
Dr. Tan, stay with us. Meanwhile, I want to introduce another guest also joining us from Seoul via Skype, Ms. San Kim, who is the chair of the Suntrans Global Asia. That's an organization trying to build border business opportunities between South Korea and China. Ms. Kim, welcome to our program. So you tell us, what is the situation in your country about its economy experiencing a pressure test as a result of COVID-19? Now, China, my country, is going through that period at least. Tell me more about yours.
Yes, if we are talking about the economic situation, as Korea is highly dependent upon Chinese cross-border economic trade of more than 25%, it's affecting very much to the Korean economy, especially in terms of trading and also trading regarding the medical equipment. And now it's kind of a way around, because Korea is experience a high peak of epidemic in Korea and cases of detection among Korean patients. So it's overall affecting the economy very much. And since people are not going outside of homes and they're not operating any economic activities, it's affecting a lot on the trade side and domestic,
I understand that. Ms. Kim, particularly about the face mask, because that's a big challenge for every country now which is experiencing COVID-19. In my country, for example, China has been scrambling over the past few weeks to try to, convert different factories into ones that could produce these masks, but still the supply cannot meet the demand. That's for sure. So, Dr. Kim, Ms. Kim, rather, from your perspective, is South Korea trying to jump on the issue, try to pop up the production of face masks, at least for now?
Yes, actually, the face mask situation is actually connected closely with China manufacturing side, because most of the mask manufacturing factories in Korea, they are supplied by the filters, which is the key part of manufacturing masks. Filters are depending upon hugely to China manufacturing facilities. But as you know, China has been closed factories for over the lunar Chunde period.
Yes.
So the supply of filters were very short in Korea. And most of the companies in Korea and factories are there trying very hard to increase the number of machines that can produce filters and other parts like nose stands,
yes,
etc. Yeah, this is a very serious situation because ordinary people cannot get access to the mask when they are in desperate need.
Do we have a timetable, Ms. Kim, at least according to the official source, as to how many masks are needed in South Korea? In what time frame can productions comes up to provide at least some proportions of those being demanded?
Well, the government is trying the best effort to secure the mask. As you know, the total population of Korea is 53 million.
Yes.
But the number of production is very limited at the moment. I believe it's less than 6 million, something like that. And in the ordinary situation, this production is not short. But because of the serious and short-term situation of a huge demand of masks, the mask is not delivered properly to the ordinary citizens. So
right.
The government is trying very hard to concentrate the mask supply to the particular hit region, which is Daegu and Gyeongsang province. That is probably why many other people in different regions cannot buy masks, even they go to drugstores or mask stores, mega stores in Korea. So this is a very serious situation. So we have to overcome quickly to supply.
Yes. Another question I want to ask both of you, that is about the travel ban or travel restrictions. Now, when we talk about travel, particularly for those countries that were hit or are hit by COVID-19, it's important to talk about import. It's also important to talk about export. Now, what is the situation? Let's just say from the medical perspective, Dr. Tan, go to you first about that. In South Korea, what are your biggest concerns of importing and exporting? How to prevent those possibilities from happening? Dr. Tan.
Well, I think we've seen the trend of fewer and fewer imported cases of COVID-19. The last case was, I think, more than a week ago, and the vast majority of our cases that we have to deal with now, of course, are domestic cases. In terms of the travel bans and restrictions for travelers moving from Korea outside, I think this is completely understandable. If you look at many of the countries, they are small island nations. Many of these countries, they do not have sort of the robust medical systems in place to deal with this kind of outbreak. If they had very serious cases, it would be very difficult for those patients, I think, to get the kinds of mechanical ventilation or ECMO, very sophisticated treatments needed. And so I understand completely why they would want to protect their citizens against the possibility of the entrance of COVID-19 through potential travelers from high-risk areas. But I want to emphasize that even though the international borders, the physical borders might be closed, the channels of communication and the networks for communication, especially among research centers and universities, these channels remain wide open, and they will undoubtedly, I think, serve as one of the most important weapons in this fight against COVID-19.
What about the communication and also interaction, if not cooperation, you just mentioned, between South Korea and China? I understand your president was in close contact earlier with the Chinese leader, and your prime minister also is leading this fight against COVID-19 right now. What about from the country level and also from the academic level, collaboration and interactions?
Exactly. So that's a fantastic question. We all heard the Secretary General of the WHO ask the member countries of the world to cooperate and to work in solidarity against COVID-19. The most helpful way to cooperate going forward would be to continue sharing viable and reliable scientific knowledge in a timely and transparent manner. I think China really led the effort with the series of scientific journals, articles that were published. China went through the fire first, so to speak. It has the most cumulative patient data, so not just Korea, but I think the entire world wants to know, what were the pharmacological and non-pharmacological therapeutics that worked, what didn't work, what about the diagnostic platforms and the challenges. We need to continue our cooperation in the academic arena.
That is from an academic perspective, the research perspective. What about from the economic perspective? Dr. Kim, Ms. Kim, you've been working, of course, on the cross-border business between South Korea and China. Now, to what extent do you think the two countries, both hit now by COVID-19, will be able to still maintain that trade interaction as much as possible and probably revive some of the earlier left out possibilities now in order to aid the effort back in your own homes, in your own countries about fighting COVID-19? Ms. Kim.
Yes, I think it's a very serious situation to block business people from going and coming to the country. And I think it's very important that the diplomatic responsible people should talk together how to solve this issue. At the beginning, the Korean government only banned the Chinese people who are coming to Korea, restricted to the Wuhan, Hubei region. But it seems that most of the Korean people who are going to China, it seems that the Chinese government is blocking Korean without restriction. So this is a very critical issue for Korean, especially business people. If they are in the quarantine for 14 days, why should they go to China? Especially if there is an emergency business talks and meetings going on. So both countries has to solve this question. And Washington recently announced that Trump said that it's not the right time to put additional travel restriction on South Korea. The U.S. decision is quite important, and it can influence the world, other countries' decision, but especially between the Korea and China, and as I explained, there's a heavy dependency upon both countries.
Yeah.
This restriction issue has to be solved on a political basis and country level, so that both countries do not affect heavily on the economic side, because it can affect to the other world economy market.
As we speak, ladies, the situation is very much, shall I say, evolving, to say the least. Things are changing so fast, and efforts and measures are also being changing as a result of realities. We'll see how things will develop, but I thank you so much, both of you, for taking your time and talking to us at this very critical juncture of your country. All the best to you and your loved ones. Really appreciate it. You're watching World Insight with me, Tian Wei. Still to come on our program, I speak to Dr. Gauden Galea, WHO representative to China, as we examine the numbers behind the coronavirus epidemic in China and many unknown. You're watching World Insight. I'm Tian Wei. A joint team of WHO and Chinese experts has completed a week-long mission in several areas of China, including the outbreak epicenter, Wuhan. The WHO team says China's efforts have averted at least 10,000 or even tens of thousands of possible infected cases. Earlier, I talked to Dr. Gauden Galea, the WHO representative to China. He has been trying to help me to understand how WHO sees the issue of the accuracy of numbers behind China's cases and fatality statistics. And while the world is gearing up efforts to contain the spread of COVID-19, so far there's still no known cure for the disease. So how can we uncover the cure? He also shed some light on all of these issues. Let's listen in.
The raw data comes from China, but beyond that, there are a large number of studies that are conducted, both by WHO as well as by independent scientists. For example, most of the modeling work, or a lot of the modeling work, has been done even outside China. The patterns of what is being seen and reported in China can now be validated with outbreaks and clusters in many other countries. So once you start to see the behavior of the epidemic, the trends in the numbers being consistent, then that continues to add to the confidence.
Dr. Galea, any of the policies that you mentioned earlier has a lot to do with the accuracy of the statistics. The people who are confirmed, the recovered, the mortality rate, and many other things. So how trustworthy are the numbers?
In any epidemic, you're fighting the virus, you're fighting the pathogen, you're caring for patients, you're identifying cases, you're bringing people in, you're testing, you're reporting, you're collating, you're analyzing. You cannot rely on just one number. You need to look at the number of cases reported. You need to look at them by date of onset. You need to look at tests among people who have influenza-like illnesses or severe acute respiratory illness. You need to visit the clinics and see the numbers of people being processed. And it is impossible to fake all these sources of data and make them all say the same thing. Beyond that, there would be an exercise in modeling to see, so if this is happening, then what do I expect here or there? And then set up sensitivity analyses where you give a range of what is the expected reality. And if you start to find that all of that is consistent, then you understand that you have a good measure of accuracy. And finally, anecdotally, being on the ground, talking to the people involved in the care, talking to the people involved in the investigation, one starts to get an increasing confidence that the numbers are as close to the reality as one can get. In the graphs that have been published, you see a big rise in the number for February the 1st. Yeah. And it's difficult to explain what happened on that date. It appears that there was a coding issue in the sense that people who were asked, at least this is the most rational explanation, that on that date people were asked when was the onset of your symptoms, and they said early February, and they were coded as the 1st of February, and you get an increased number of cases there. So you do get, and this is part of the reality of working with an epidemic of this nature.
There is a debate now, Dr. Galea, about the fatality rate. People around the world are afraid. that the outbreak would go to their country too. What do you make of the current debate about whether fatality rate is approximately what it is being reported in the numbers, or actually there are a lot of missing points as some could be suspected of?
The practical question is it's impossible to know the accurate case fatality rate until the whole picture is ended. The pattern of mortality generally is much smaller than at the beginning, but it is not a negligible number. The general pattern that we are seeing in China was, at the beginning, there was a very high rate because most of the early cases were the most severe, the easiest to detect. And there was a very high rate of mortality among them. As it was understood that the disease has a broader spectrum and the case definition evolved to consider a broader range of presentations of the disease, the base population grew larger and the numbers of deaths proportionately smaller. Later in the epidemic, as the cases are getting more and more resolved and either in the main recovering, that's the most cases, and the small minority unfortunately die and succumb to the serious forms of the disease, that number is now increasing in number of deaths.
The Spanish flu, which is the biggest epidemic we have seen, 2 to 3%, if I remember right. People are already suggesting, experts particularly, that this could be very severe. Your take?
In China, we see two patterns. One in Wuhan, where there's community transmission, there's a huge burden on the health system. There is a higher risk of dying than in the rest of the country, where the risk is very small. So with populations that are well prepared, with good health systems that are ready to detect and provide immediate supportive therapy, where there's a very quick identification of cases and a very quick initiation of support and case management, the mortality has been kept quite low. It is still, though, causing severe illness in 15 to 20% of the cases, and that is not to be disregarded. So it is a formidable condition and one that requires to be taken with attention.
Dr. Gauden Galea, the WHO representative, in our conversation, the exclusive interview, he also touched on several important questions still unanswered related to the virus. However, he did indicate, as long as the genome sequence of the virus is clear, we can at least do a lot to prevent and control COVID-19. What about the fact that we still do not know much about the virus? No patient zero discovered, no already tested remedies and vaccines. We do not know 100% the host of the virus and the immediate host of the virus, and meanwhile some of the early evidence were already not existing. So what does this say to us, Dr. Galea, about how much really do we know about this?
We are in a situation where we do know now what are the essential tools needed to stop it, even in the absence of a vaccine and of therapy. It's also recognized that there are questions. What is the ultimate source? It's very important to continue to investigate that, because the last thing one wants is to have this epidemic end and then for it to be started again. That is untenable. So that research is very important. We are still without a vaccine and treatment. The research on that it must be a huge priority, because it is entirely possible that this disease could become like an influenza that could persist in the human population.
I noted you say like influenza, but certainly not influenza.
It is not SARS, it is not influenza. It's a virus, it's its own disease. So I said that in order to suggest that there is the possibility that it could become endemic. It could become a virus in our environment that humans have to live with over time. And that, if that happens, then you do want to have these active tools of vaccination for prevention of cases and of treatment for any person who gets infected and needs that treatment. The time to do much of that research is now, while there are a lot of cases around, and to be able to allocate cases to the trials that are needed to ensure that there are the therapies both for the present but also for future encounters with this virus. So all that you say about the source, about vaccination and treatment is part of the global research framework that has been pulled together with the participation of Chinese experts at a global meeting held recently in Geneva. So there is a blueprint for research that is the imperative that we need to go forward.
What about the earlier cases of COVID-19? In November, there were already reports that many cases already existed, but some were even suspicious of earlier than that. So, Dr. Galea, how will resolving the myth of this help us to understand the real nature of this virus and the origin of the virus? Do you think WHO is urging important sides to do work as much as possible on this front as well? Because this is the ultimate question that needs to be answered, as you already indicated.
Certainly, it is extremely important to trace back as far as possible in the history of the epidemic. And the Huanan seafood market, in a way, presented for China as much as for WHO an indicator that there had been a spillover from the animal world into the human world, that somewhere it had happened. As I have, I think, even said in our last conversation, all of these cases were happening at a time of increasing influenza-like illness. And the multiple episodes of people with respiratory symptoms, even serious conditions, would have been masking what was clearly low numbers. There were not the large numbers that we are seeing now. So how far back does it go? It's very important to be looking at past imaging studies done in hospitals, to trace back lineages of relationship and transmission between cases and deaths. That investigation needs to be completed, as well as the animal-human interface. We need this in order to be able to reassure ourselves that there is not a cause of continuing transmission. But that does not diminish the force of what I have said earlier, that all the current cases are especially outside Wuhan and Hubei, are cases where we have household information about household clusters, and it's very much of a different pattern than there was in the early stages. So we need to continue that research, high priority, but at the same time continue our work on case definition, contact tracing, and the management of both.
Yeah, last question about whether it is lab-produced virus. I see there is a debate in the society. However, experts have been speaking out around the world. Your take?
There's a bat involved. So at some point, the genes are similar, very similar to a species, to that of a coronavirus found in a species of bat. The important thing is to identify which animal is the cause and where is the lineage. It does not. One hears about multiple debates. They need to resolve themselves in a scientific fashion. We have to continue the epidemiologic investigation.
Dr. Gauden Galea, the WHO representative to China. That's all we have for today. If you'd like to see more, try to find us, World Insight CGTN. You can search us online. You can also find us through YouTube channel and also Twitter and Facebook accounts. I'm Tian Wei. On behalf of my team, thanks for watching, and bye for now.